السلام عليكم. اليوم موضوعنا عن midface fracture or middle third fracture. The facial skeleton can be divided into upper, middle, and lower third. The lower third is formed by the mandible. The upper third is formed by the frontal bone, and the middle third is the region extends from the frontal to the upper teeth or alveolar bone. The middle third of facial skeleton is formed by bones which articulate with each other in immobile suture. These bones are two maxillary bones, two zygomatic bone, two nasal bone, vomer bone, sphenoid bone, and ethmoid bone, and two anterior cones. The bone of the midface constitute a series of vertical and horizontal buttresses. These buttresses of the face consist of thick bone that transmit the tuned force to support the supporting region of the skull. تقسم البتروسس إلى vertical اللي هي النيزوماكسيلاري الزيجوماتيكوماكسيلاري عن تيرجوماكسيلاري بتروسس. أما الهوريزونتال عندنا السوبراوربيتال ريم أو الفرونتال بار الانفراوربيتال ريم and zygomatic arch buttresses, which the buttresses البتروسس joined together by lamellar thin bone. وهذا يكون weak bone وممكن يصير fracture in the future إذا صار accident أو any injuries. The etiology of the fracture: RTA, fall from height, occupational accident, fighting, and sport injuries. The Lefort classification: René Lefort described the classical fracture pattern of the midface and determined three main levels of fracture: Lefort 1, Lefort 2, and Lefort 3. Lefort 1, also called groin fracture or low-level fracture, is caused by forced delivery above the apices of the teeth. The fracture occurs at the level of piriform arches and involves the anterior and lateral wall of maxillary sinus and the lateral nasal wall with pterygoid plate. أيضا يصير به fracture at the junction of lower 1/3 with the upper 2/3. ممكن يصير عندنا unilateral maxillary fracture والfracture line passes through the palatal suture or adjacent to it. The clinical feature: so the malocclusion and mobility of the whole tentoalveolar segment of the upper arch, hypoesthesia of the infraorbital nerve, palatal ecchymosis of the palatal ecchymosis or Gorn sign اللي هي هاي الصورة اللي تعتبر the sign of the Lefort 1. Ecchymosis and tenderness, crackpot percussion sound, and fracture cusp of the teeth. Lefort 2 classification is also referred to as pyramidal or subzygomatic fracture. This fracture involves the frontonasal nasal suture, nasal and lacrimal bone, and infraorbital rim in the region of zygomatico-maxillary suture, maxilla and pterygoid plate half away. It can be unilateral and bilateral. The clinical feature of Lefort 2: edema, mobility of upper jaw, step deformity infraorbital rim, bilateral circumorbital edema and ecchymosis, cerebrospinal fluid rhinorrhea, epistaxis, hypoesthesia of infraorbital nerve, malocclusion, cracked pot sound, difficulty in opening the mouth, and possible diplopia. Lefort 3 fracture, also called craniofacial disjunction. It starts at the frontonasal suture, running through the frontomaxillary suture, over the lacrimal bone to the lamina paprica of the ethmoid bone and toward the optic foramen to reach the infraorbital fissure. The fracture line divided into two lines. The first line is the anterior lines pass around the frontal zygomatic suture to separate the zygomatic bone from the frontal bone, and the other bone passes posterior to fracture the pterygoid plate at the root, thus separating them from the cranial face. The clinical features of the Lefort 3: abnormal mobility at the frontonasal and frontal zygomatic suture, classic disc face deformity مثل ما موضح بالصورة, facial edema, circumorbital ecchymosis and subconjunctival hemorrhage, cerebrospinal fluid leakage, crackpot sound. There may be gagging of the occlusion in the molar area. Imaging. A plain radiograph have only limited rule and they are indicated when the 3D imaging CT scan is not available. This may be include occipitomental projection and lateral projection. The occipitomental view, water view, is useful plain radiograph. We take two projection angle at the 10 and one at the 30 are desirable. This view will demonstrate uncomplicated middle third fracture with sufficient detail to determine treatment plan. أما lateral projection view ممكن نشوف بها الليفورد type fracture 1, 2, 3 can be detected on this view where the fracture line can pass across the pterygoid plate. It's often only plain view that clearly demonstrates Lefort fracture 1. A CT scan or CBCT with the multiplanar and 3D reconstruction is indicated for visualization and delineation of magnitude and comminution of the midface fracture and for the identification of adjacent fracture. هاي عندنا صورة توضح CT scan and the occipitomental projection, and this is the picture of the lateral projection or lateral cephalometric. The treatment of Lefort. First observation is indicated in non-mobile or minimally mobile linear Lefort 1 fracture with unaffected occlusion. In Lefort 1, 2, 3 fracture in edentulous patient with atrophic maxilla, provided that they are non-displaceable stable fracture. In edentulous patient with minor displacement in case when the general medical condition does not allow surgical intervention. ننصح البيشنت انه ياخذ soft diet for several weeks و close follow up is required and patient should be complained. Surgical intervention. Reduction and fixation. Effective reduction of maxillary fracture depends on the degree of mobility of the Lefort fracture following the injury. In some situations, it may be possible to reduce low-level maxillary fracture simply by finger manipulation alone. Otherwise, paired raw disinfection forceps can be used to manipulate the fracture into place. Also, Huyton-Williams forceps can be used for the same purpose مثل ما موضح بالصورة اللي هي paired of raw disinfection forceps بالصورة اليسار. Fixation. Applying IMF using interdental wiring or arch bar alone is insufficient to stabilize the middle third of facial skeleton because the mobility of the lower jaw. فلهذا نستخدم open reduction and internal fixation اللي تعتبر the current method of the choice in internal fixation with the mini plate, micro plate, 3-dimensional meshes and screw. With this method, it's possible to fix even the small fragment and to stabilize bridge area of comminuted fragment in the vitreous region until the fracture have been consolidated. الموضوع الثاني اللي هو nasal bone fracture is one of the most common fracture due to its prominent position and little protection and support. The nasal bone are relatively thick superiorly where they are attached to the frontal bone but are thinner inferiorly where the upper lateral cartilage are attached. Hence they are more susceptible to fracture lower down. According to the force applied, the nasal complex fracture can be divided into 3 planes. The first plane is involve the nasal tip only. The second plane involves the whole external nose anterior to the orbital rim, and the third plane is much more severe, involving the medial orbital wall and sometimes the anterior cranial fossa. The clinical features of nasal fracture: edema over the bridge of the nose, bilateral circumorbital ecchymosis, subconjunctival hemorrhage, deviation of the nose to one side, and epistaxis, septal hematoma, nasal obstruction. Imaging. Isolated nasal bone fracture can be visualized on lateral nasal radiograph on CT scan, and the septal deviation are visualized on acceptomental view or CT scan. Treatment of the nasal fracture. Septal hematoma require incision and drainage which should be performed under topical and local anesthesia. مثل ما وضع بالصورة إن هنا عندنا septal hematoma فنسوي له incision and drainage. If untreated, it can become infected, leading to septal abscess, which risk of intracranial extension. It may also result in avascular necrosis with loss of cartilage and septal perforation. The vast majority of nasal fracture can be treated by close manipulation and simple splinting. Reduction. This can be achieved by digital manipulation in simple fracture. Otherwise, Wilsham مثل ما واضح بهاي الصورة Wilsham forceps are used for manipulating nasal and frontal process of maxillary bone fragment, and vomer and perpendicular plate of the ethmoid are then manipulated with ash septal forceps. هاي Wilsham. الميثود of embolization. Raping gas baking مثل ما موضح بالصورة هنا هي raping gas such as bismuth, iodoform, paraffin paste is lightly packed into nasal cavity to impart support and to achieve hemostasis. ويستخدمون plaster of Paris supplant 6 to 8 layer of plaster of Paris bandage cut to produce a strip of plaster across the bridge covering either side of the nose with the extension up to the forehead. آخر شيء عندنا open reduction and tunnel fixation of the nasal fracture. Open reduction and tunnel fixation of isolated nasal fracture is a procedure that is rarely advocated. Indication may include grossly displaced fracture where close treatment is usually unsatisfactory and when there is an extensive overlying laceration.